How does transverse myelitis differ from MIS regarding bladder issues? When it comes to bladder issues, how do transverse myelitis and multiple sclerosis differ? Both conditions can lead to bladder dysfunction, but the way these issues present can vary significantly. Transverse myelitis, or TM, primarily affects the spinal cord, causing inflammation and damage in a specific area. This localized damage can lead to a sudden onset of bladder symptoms, such as urgency, frequency, and incontinence. In fact, nearly everyone with TM experiences some form of bladder dysfunction during the active phase of the condition. On the other hand, multiple sclerosis, or MIS, impacts multiple areas in both the brain and spinal cord. This means that bladder dysfunction in MIS tends to develop more gradually and can fluctuate over time. Individuals with MIS may experience overactive bladder symptoms, including urgency and frequency, but they can also face issues like urinary retention due to a lack of coordination between the bladder muscle and urinary sphincter. The severity of bladder dysfunction also differs between the two conditions. In TM, bladder issues often appear suddenly and can be quite severe. Recovery can vary. Some people regain normal bladder function, while others may deal with lasting problems. In contrast, bladder symptoms in MIS may start off milder but can worsen as the disease progresses. The fluctuating nature of MIS can lead to intermittent improvements and worsening of bladder symptoms. Additionally, the types of bladder dysfunction observed can vary. TM can lead to both overactive and underactive bladder symptoms, depending on the location and severity of the spinal cord lesions. Meanwhile, MIS typically presents with overactive bladder symptoms and coordination problems between the bladder and sphincter muscles, which can result in incomplete emptying. Both conditions can also be associated with other symptoms. TM may cause bowel dysfunction, sexual dysfunction, and muscle spasticity due to spinal cord involvement. MIS, however, often presents a broader range of neurological symptoms beyond just bladder issues due to its multifocal impact on the central nervous system. In summary, bladder issues in transverse myelitis are usually acute and linked to specific spinal cord lesions, while bladder dysfunction in multiple sclerosis tends to develop gradually and can fluctuate with disease activity. Both conditions requiring careful medical evaluation and management tailored to the individual's needs. Always consult healthcare professionals for personalized advice and treatment options.